I now give the floor to Ms. Sarah Kline, Chief Executive Officer and Co-founder at United for Global Mental Health.
Thank you. Today I'm speaking on behalf of my organisation and the 8,000 mental health advocates of the Global Mental Health Action Network in 170 countries that we coordinate. But I'm also speaking as a person living with bipolar and anxiety from the age of 9. This is me speaking to you professionally and personally. Together, my team and the Action Network members have worked tirelessly with other mental health organisations, member states, WHO, UNICEF, the NCD Alliance, researchers, academics, mental health service providers, and the private sector to make the most of this historic moment, the first UN high-level meeting to feature mental health at this level. Together, we set out to show you what was essential to declaring this high-level meeting and its political declaration a success for mental health. There have been meetings with over 100 governments, not just organised by civil society, but by the many organisations with which we have joined hands. We have helped explain the changes we want to see and why. We have secured new government commitments, even in the past few weeks, and expect to hear many more today. We have seen an outpouring of personal reflections from senior leaders on why mental health matters to them. When it comes to mental health, we can all speak professionally and personally. What did we call for? First, today WHO reports there is just one outpatient facility offering mental health support in low-income countries for every 1 million people. Countries spend their tiny mental health budgets on locking people up, not caring for them in their communities. We called for strengthening mental health systems through moving from institutions to integrated primary and community-based care, and governments have committed to do this in the declaration. They have committed to provide 150 million more people with access to mental health care. Second, half of all mental health conditions develop by the age of 18, of which I am one. Yet mental health services overwhelmingly focus on adults still today, leaving young people and their loved ones with nowhere to turn. In the declarations, governments went some way to recognising young people need support, but we agree with UNICEF, WHO and many others. We need greater action now. Third, suicide accounts for more than 1 in every 100 deaths. Suicide is illegal in 24 countries, causing pain and suffering when we need to be offering hope and support. We called for the decriminalisation of suicide and actions to prevent suicide. With much debate, governments have now committed to this. Fourth, we called for the protection from social, economic and commercial determinants that damage our mental health, the mental health of everyone here. Governments fell short on meaningful commitments, and we will join the NCD Alliance and many others in continuing to call for greater action. And I'm delighted today to speak alongside UNEP in advocating for mental health to be fully integrated into action on environment and climate change. This high-level meeting is a historic moment. This declaration will not be perfect, and governments have not made all the commitments we would like them to make, but we have only just begun. For governments to succeed in providing better mental health services and support, they will need systematic and meaningful engagement with people with lived experience and the organisations working most closely with them. Otherwise, how can governments be sure their policies, plans, and investments in mental health will work? Together, we will once again join hands with all our partners. We will keep advocating for urgent action on mental health. Mental health affects all of us. This is just the start. Let's work together to deliver good mental health for all.